Thank you so much for your presentations. We will check if people that are watching on Zoom will have some questions to ask. I'll sure have one, and maybe some of my colleagues that are here with me presentially will also have. Are you listening to me, Catherine and Michelle?
Yes, I hear you. I'm here.
Oh, I repeatedly heard you mentioning testing and then retest, okay? Not basing the decision on one test.
Mhm.
So, in terms of science, it looks like that we have enough scientific evidence to do so, yes, for a decision, especially if the animal is in a health condition, okay, no signs of disease. But in Portugal, lots of times we have the situations where with a single test, there is the decision to perform euthanasia on an animal, even if the animal has no clinical signs of disease. Animals are taken sometimes to be spared, tend to and if they test FIV&FeLV, the decision seems to be with one test to do so. So I would like to really hear back your opinion about that situation, because
Yes.
as you mentioned and we
Mhm.
saw in a video, I myself I've been owner of many animals all my life, animals that are FIV or FeLV positives, and some of them didn't even die of the disease. Okay, they died of something else. So it's strange for me to take the decision of euthanasia based in one single test.
Okay. So first of all, of course, this is what we recommend, right? And we would do it in every cat that comes to us, in which we are able to retest, right? Because we do have a low prevalence, and this is still true worldwide, because these tests can be false positive, and we do want to avoid that we just have a false positive test and make whatever decision based on this false positive test. This is why we retest. This is why I recommended to retest, and Nikki said it in her talk, to retest. So there are some gold standard tests that we can do, right? We can send it off to a laboratory or something, but this sometimes takes too much time. So what we do, sorry, what we do is we just do a second test of a different brand, a second in-house test of a different brand. And I could show in one study that this really, really increases the likelihood that the test is true. So this is what we would recommend, and what you should do in every veterinary practice and at income in a shelter. Sometimes you might have the situation that you test stray cats and you can only do one test. And I understand if the question is, if you have a stray cat that cannot be brought into a shelter or into a different environment, it's very difficult to release a cat again that is positive, because that would mean the whole environment is, can be infected. So whenever you have a stray cat that needs to be released, I think you cannot release a positive cat again into the environment.
But performing two tests or just one?
I would suggest, if possible, if at all possible, I really, really would strongly recommend to do two tests.
What about in situations of trap and neuter and return to test animals? Sometimes they are even less than 6 months old with no disease, no signs of disease, and they test positive, or even a healthy animal that tests positive.
Okay, this is a difference. As I explained, there's a big difference between FELV and FIV, right? If a young cat, less than 6 months, tests positive for FELV, and you repeat the test immediately with a different set, and the cat is positive, this cat has FELV infection for sure, because there are no maternal antibodies interfering, right? This cat has to be taken out of the population. hopefully not been euthanized, hopefully go in a shelter that has specific facilities for FIV. But in FIV, it's usually maternal antibodies. So usually this cat is not infected. So ideally, again, you would take this cat into quarantine and then retest after it's 6 months old. That would be the ideal situation. If it's not possible, the problem is always you have the population and you have the individual cat. You have to take these cats out of a population. You have to get them into a shelter and have specific shelter facilities like Nikki explained. And we have these people, the 2 people that now have prepared that nice video that work with specifically for FIV and FeLV infected cats to rehome them, because they show with their video, it's very, it's very, very rewarding to have an FIV or FeLV infected cat at home. Just one thing I want to mention about the video, Nikki, because it didn't come out. These cats are only in a fenced environment. They are not free running. We do not allow them to run outside and infect other cats. They have to have a fence. They can live on a balcony, but they cannot be in contact with other cats.
I will ask if we have some questions on this. Yes, we have. Okay.
But I also want to mention the AAFP also gives a recommendation for trap and neutering programs. So Katrin mentioned the perfect situation that the cat is being tested and then brought out of the population to rescue organizations or something like this. And if this is not possible, the AAFP and also the ASV recommend not to test cats if they are really.
But this is a specific situation, Nikki. This
Yeah.
is only I was involved in these guidelines. This is only if you have if they are all housed separately and then they have to be tested before they are rehomed. So the owner has to test them. That's what they do.
Yeah, I mean the programs that neuter cats and release them again and do nothing with them. So
it also depends where they are.
Yeah. If a test result has no consequence, so they.
If the test has no consequence, absolutely. If the test has no consequence and you release them anyway, then you don't need to test. Then you don't need to test them, take the money. So there are some questions about that. If they live in a colony, then some of these cats will be infected, others will not be infected. And this colony is not stable. If you have a very stable environment, if you have a household and you have like 6 cats and 1 is positive, and you don't get any new cat into that household, then, like FIV, if that's stable and the cats are not fighting, then it's possible. But in the environment outside, there will be new cats coming and there will be a lot of fighting going on and there will be a lot more infections and infections and infections. This is something you should not risk. If you test, if you have the opportunity to take the cats into separate shelters to try to rehome them, then yes, you should test. But if I know a cat is positive, it's very difficult to release them into the environment.
So what Michelle was saying about the release in the environment was related with situations of trap, neuter, and return.
Yeah,
the animals are not domesticated. They will not be able to get an owner to be adopted because they are kind of not totally wild, but some of them are wild.
Yeah, and then you should save the money for other investigations and not test if it doesn't have a consequence. If the cat is right.
Yes, exactly.
We will see the questions. Pode ser aqui. Consegue lê-las?
Yes.
We have one or two questions.
All about the mass sterilization and everything. Exactly. So I think we answered that. There's a very important question. In case of FIV positive cats, How efficient is the vaccine to protect other cats from exposure to the disease? Are there any studies about the efficacy of the vaccine? Yeah, there are a lot of studies. So the vaccine against FELV, we are talking about FELV, right? The vaccine against FELV is effective, but not if you keep the cats together. It's not 100% safe. I mean, you can, when you have an environment, and if you're in like a household, an owner that has FELV positive and negative cats, they have been together for a long time, then very likely the other cats in that household have already infection, maybe not progressive infection, but abortive or regressive infection. So it's not that dangerous in a household situations when you do not have new cats coming in. But in a shelter situation, when new cats are coming and cats are mixing, cats are going, cats are coming in, it's not safe to bring in an FELV positive cat, even when the other cats are vaccinated. This is not safe enough. The vaccine, if the cats are living together, the vaccine is not safe enough. There are enough studies to show that.
We are trying to select one or two questions from the chat, from Zoom and Facebook, but we have a colleague just trying to help us with that, because we have to do it with another microphone to see if we can have those questions being answered. But yes, indeed, while they're still looking for it, I very much agree with Michelle. If it's always very important to have tests and testing. If we can do something with it, okay, because one test out of nothing gives us nothing, or probably it can give a wrong decision. So maybe it's better to use that money to do other things. But testing is always very important, because we will need to know prevalence of the disease, of course, and prevalence of situations. But to take just one test and have a decision about that animal, it's something very, very difficult. And as you show in your scientific presentations, we could be wrong. We could be wrong with just one test and one decision out of that test. So do we have any questions, or?
There is one more question in the chat. Like the first question was about, cats that are repeatedly antigen positive but negative for proviral DNA. And the thing is, there are two possibilities. Some of the commercial laboratories, they do have a PCR that's not very sensitive, so that PCR will not pick up the proviral DNA. So this is sometimes really difficult. And then the PCR is false negative. This has happened many times. This is one possibility. The other possibility are cats with focal infections, focal FELV infections. And these focal FELV infections, they sometimes have discordant results. So you have antigen positive, but PCR negative. So these could be focally infected cats, but you need to treat them as infected cats, because these cats also can shed the virus.
Okay, we have two questions that we're going to ask now from the chat that my colleagues have pointed out. See if they can ask from the microphone over there.
Professor Laurentina, working? Yeah.
It's working, yes.
Okay, perfect. The question is, when should you do a PCR in a diagnostic approach of a cat that gave FIV&FeLV positive?
So this also depends again on the situation. If you need to know immediately what the problem is of the cat, or if you have more time. So the gold standard procedure would be you do first your antigen test, and then you do a PCR in addition, because this is the gold standard confirmation test in a positive cat, right? If you have, so then you would do the PCR. You also could do the PCR in an FELV antigen negative cat if you want to see whether this cat has regressive infection. this would be a different situation. But FIV positive, the PCR is used for confirmation. If you do not have a lot of time and if you cannot wait for that PCR result, then the alternative is to take a second in-house test for confirmation from a different brand. So if you use the IDEX, then maybe you use for confirmation, you use the witness test. So this is an alternative to the PCR, right? PCR would be our gold standard, but if it's difficult, not available, then we can also use another in-house test.
Okay, do we have another question?
Yeah, another question, sorry. Katja Marx asks if there have been some reports about cats with hematological disorders that are repeatedly antigen positive. But
I already answered this one. I just answered it, that this is either a false negative PCR result, because commercial labs sometimes have a low sensitive PCR with low sensitivity. We have had these cases. When we send the sample to a university laboratory, the cat is positive. Or it is a so-called focal FIV infection, where the infection is only in the bone marrow, only in the spleen, and these cats sometimes have very strange results. So sometimes are positive with antigen, but negative with PCR. This can happen.
Okay, thank you so much.
Ok. Alguma questão na sala? So, okay, well, we have no further questions. So, Catherine.
There's one in the chat. I think there's one in the chat about, so the recommendations would be to ideally have separate premises for FIV and FeLV to keep them apart from FIV and FeLV negative cats in shelters. Yes, that's exactly what Nikki said. This is ideal, or to try to rehome the cats as soon as possible. Yes. Yeah.
Now, I was wondering, because that US study revealed that many shelters give the retrovirus positive cats to new homes, regardless of another cat in the new home. So or the FIV FELV status, which is scary, I said. And Catherine, what would you say if you have? Of course, you would never you would never recommend a cat for adoption if it is FIV positive or progressively FELV infected when the new owners have another cat, a negative cat in the household. What would you say if the new owner has an old cat in the household, retrovirus negative, and they have a regressively infected cat? What would you do?
Regressively, in fact, not progressively.
No, not progressively. Regressively infected cat. In a household.
You mean a cat that's PCR positive?
Yes. Yeah.
I would probably talk to the owner that there is a certain risk, but only a very small risk that the cat gets reactivated. It depends a little bit. Do I know regressive infection for a long time, or is it a new result? How old is that cat, right? Is this a young cat or an older cat? With an older cat, I'm not that much worried. If it's a young cat, then the likelihood that there might be reactivation is still there. I think we would need to talk to the owners about a potential risk, but a very low risk.
Mm-hmm. Yeah, and what we did not do, we did not talk about the age, that older cats are less likely to become progressively infected. So maybe this is also information for the.
It's important. Yes, indeed, it does help. So, okay. So thank you so much for your talks, for your insights. And we will be carrying on here with another webinar, more about the data that we have here in Portugal that we will be willing to share with you, because I think, Catherine, these are recent data from the studies we have here from our colleagues at the university, and will be very interesting to share. And on my side, I will try to work on advise that euthanasia is something that to be performed with a healthy animal with no symptoms, no signs, just out of one test. It's something that the veterinarians should think about it, especially when we talk about animal welfare and opportunities for the animals to have a life. Okay? So thank you so much, and we will be back in this room later in Portuguese, okay? But we'll share with you the information that we will carry on here on another webinar. Thank you so much. Thank you, Catherine. I will switch on now to Portuguese a bit, okay? Thank you so much. Só realmente relembrar que nós vamos ter um seminário em português. Será mais fácil para as pessoas que nos estão a ouvir estarmos na nossa língua própria. Realmente ouvimos duas palestrantes muito importantes, quer do ponto de vista académico, quer do ponto de vista científico, quer do ponto de vista prático, porque a Michelle trabalha com muitas shelters e hoje há que fazer uma gestão correta das atitudes que nós temos em relação a duas doenças que são muito complicadas. E por serem complexas e complicadas, no sentido complicadas, na complexidade não há uma direção única, há variáveis e há situações que não podem ser assumidas da mesma forma, como acabamos de ouvir hoje aqui. FIV e FeLV, quando se testam-se condições diferentes. Numa testa-se antigénios, noutras testa-se anticorpos. Portanto, a abordagem a resultados positivos tem que ser muito, muito delicada. E a abordagem a resultados positivos, como ouvimos aqui, só é cientificamente correta se tivermos dois resultados. E, portanto, é isso que nós vamos tentar explicar agora, depois de um curto intervalo, porque vamos começar às 12 e deixar para quem nos quer acompanhar agora em português. É sempre realmente muito mais fácil, mesmo para quem percebe inglês, mas o inglês vem com o sotaque próprio também dos palestrantes e com a forma como nós nos expressamos, e realmente na nossa língua é mais fácil. E penso que vamos voltar então às 12, penso que nessa altura haverão mais questões. A palestra das 12 horas vai ser dada pelo meu colega Dr. Pedro Almeida, que é uma pessoa muito experiente em medicina felina, eu diria um dos médicos veterinários deste país com mais experiência, e de alguma forma também vai falar de algumas novidades, nomeadamente novidades científicas, porque nesta faculdade tivemos pela primeira vez, ouvimos a Catherine falar de um estudo que foi feito em animais FeLV, animais aos quais foram induzidos a doença, e que era a experiência que havia mais sobre o tema. Nós temos a experiência realmente de um animal que nós tratamos há alguns anos, exatamente com o mesmo medicamento que ela se refere, e que realmente nos mostrou e nos ensinou muito sobre o possível tratamento de uma das variantes destas manifestação desta doença. Mas, portanto, a partir das 12, eu agora já nem sei que horas são, alguém pode indicar? Como? 20 minutos, dá tempo das pessoas tomarem um café, está bem? E depois ouvir o professor Pedro e Almeida e algumas das conclusões que nós podemos ter e outras que devemos pensar, está bem? Então, voltamos ao meio-dia com o seminário, com o webinar em português. Até já.